All right. So for ovary tumors, they are quite up to like 10. So I've been picking the ovary tumors one by one to actually discuss about. You understand? So for the next ovary type of tumor we should be looking at is what is known as a granulosa cell tumor. You understand? So for the granulosa cell tumor, we'll talk about the characteristics. Of course, the characteristics should help you be able to differentiate it from the other types of tumors that could actually occur in the ovary. You understand? So for the granulosa, you could see how this tumor could actually present like. All right. So it's just a rare type of ovarian neoplasm. When we say neoplasm, we say cancer. So it arises from the sex cords. Okay. Specifically, the granulosa cells involved in estrogen production. Now, can you start reasoning the complications that such a person will have? Okay. So what is supposed to provide estrogen is having problems. Right? So these tumors are hormonal active. So you have plenty of estrogen being secreted. So this is what causes the issues. So type, we have the adult one, which is about 95% of the cases affect people around 50. Juvenile, we have the one affecting people around 30. So symptoms. Now, because of estrogen secretion is too much, such a person is having menstrual cycles that are irregular. All right, such a person might have hit the person must have hit menopause, but the person is still bleeding, still having periods after menopause, after 45. The breasts are tender, abdominal pain or bloating, early puberty in young girls. Then the endometrium is so large, is increasing in size. It could also result into cancers of the endometrium, because the cells are now growing out of check. So most of them, these are the genes, all right, affected. FOXL2, AKT1. So diagnosis is of course, the ovaries are buried deep into the pelvis, so I want to actually do an imaging to confirm. So ultrasound or CT scans or MRI. Then hormonal markers, I'll check if some particular hormones are elevated. Hormones like inhibin, estradiol, Mullerian inhibiting substance. Then endometrial biopsy, just access estrogen related changes. Treatment is, I'm having a tumor, so I have to resect it out. So I'll now use chemotherapy to just clear up the remaining cells that weren't resected.